Hello and welcome to everybody, and particularly welcome to Beth Cooper, who, well, actually, I think you may be our first nurse. I'm not sure we've actually had a nurse. We've had a range of different healthcare professionals, but I'm not sure that we've necessarily had a nurse on. So welcome to our first nurse.
Thank you.
So Beth is going to talk to us today. She's going to talk to us about chronic conditions and management of them, but very much in the setting of how to, I suppose, to try to manage them, that they don't get into a critical state, although you're going to be it's a very broad brushstroke, so obviously we're not going to go into lots of conditions, you're going to give an example. But it's all very much tied up with one of Beth, and you'll explain in a minute far better than I, Beth, about your passion for computer literacy and how important, particularly in this day and age, it is that we promote health literacy to people. And also, probably a good idea, I know we banned it around, but do people really understand what that means? So if we can have an explanation of that, that would be great. But first of all, tell us all about yourself, Beth.
So, yeah, I am a nurse. I've been a qualified nurse for about 5 years. My background, as you've said, is in emergency medicine. And more recently, alongside this, I've begun medical writing. It's kind of to circulate evidence-based content to the public, which is something I'm obviously quite passionate about. And like you said about the health literacy aspect, obviously as a nurse, I've come across patients from all walks of life. A lot of them do have a very clear understanding of their own personal health, but a lot of them don't. And I guess my aim really is to improve kind of engagement and understanding of health in this area.
Yes, and I think it is, I mean, obviously at Talk Health, what we advocate is getting people to understand and educate. What we want to do is provide a evidence-based. And when we mean evidence-based, that means that it's something that has clinical founding behind it, or very, very strong anecdotal evidence behind, the advice that one is giving. And I think it's just so important to stress evidence-based information is absolutely critical. And I'm sure in A&E, I'm sure you'll have had people coming in and say, well, I thought that you could do this, this, and this, which maybe, I mean,
there's so much information out there now. We're in a digital era of medicine. There's so much information out there. And I think what you say is right. The importance of getting your information from an evidence-backed, research-backed sources is vital, really.
Absolutely. I mean, at Talk Health, as people may well know, we all of our information that we provide, particularly on our patient support programs, is run through something called the Patient Information Forum, called the PIF-TIC, which I think most charities are absolutely on board with, and now also a lot of pharmaceutical companies getting behind it, which means I think it has to go through 5 layers of people, of medical people, lay people, everybody reading the information and citing your sources. So I think, once again, that is very important. So talking about health literacy, actually, it's important to look at what you're reading. So you might be health literate, but if you're reading the wrong stuff, that's not great either, is it?
No, exactly. And I think the phrase health literacy kind of makes it sound very formal, doesn't it? Literacy. But it's quite a simple concept, really. It's a kind of about a person's ability to understand information, but not only to understand it, to utilize it to make decisions around their own health. And I think there's a lot to do with kind of the level of patient engagement and their ability to make well-informed decisions, around their own health and that of their family, and that's kind of what it's about, really.
And so, did you train to be an emergency? I don't know. With nursing, do you train to be an A&E, or does it just happen?
No, so I trained as an adult nurse. It's quite general adult nursing or children's nursing or learning disability nursing, and then I've gone on to work in an emergency department and done another degree around trauma predominantly. But you don't train specifically as an A&E nurse. That's come since qualifying.
And is it once you? I mean, what was it attracted I mean, because I suppose we all think of ER and all the sort of dramatic Holby City and all of those dramatic. I mean, is it like that really, or?
Some days it's a bit like that, but not. I do watch Grey's Anatomy, and it's not like that at all.
Oh my god, I love
that. But some days it is a bit like that. I mean, every day in A&E is very different. You know, you don't know what you're going to see, and that is actually something that drew me to it initially. I like the prospect of seeing a wide range of conditions and acute episodes of care, and getting like a knowledge base of everything, a little bit of everything rather than a lot of one thing.
And how does care, I mean, I suppose the obvious is that you have to do something very, very quickly rather than waiting longer to when you treat somebody. But does nursing change very differently from an A&E situation to just on the ward?
I would think so. I've never actually worked in a ward environment. I went straight to A&E from qualifying, but the care is very different. Obviously, you're there to treat an acute episode of care rather than a chronic condition and manage the symptoms of that chronic condition. Obviously, the two do intertwine when things happen. People come to A&E for acute episodes of a chronic condition, but you're there to treat what's happening right there, right then, rather than what's been happening for the past few months, say.
Absolutely. So when we say, I was just sort of looking at what we've got down, when we're talking about health literacy, what do we really mean by health literacy?
Well, it's like I said, it's an understanding of health, and it's the ability to use that understanding to make decisions. So I think in the context of the pandemic, for example, we've been thrown into a completely different way of operating the past few years. People have had no choice but to recognise and respond to health related information, and the challenges of kind of complex health decisions and systems of care. And I guess what I'm trying to do really is just to keep the momentum going in terms of people wanting to engage in health and their own individual health, and using that information to promote better outcomes really.
And I suppose why is it so important?
Well, I think there's many research studies that will talk about this. Just to break it down a little bit, I think the effects of a poor understanding of health and poor patient engagement has got numerous negative connotations in terms of kind of clinical outcomes, utilization of services, management of conditions, and comprehension of kind of treatment options and medication. And all of this has a very dramatic impact on not only a person's individual health, but on public health, in terms of kind of pressure on services and global health outcomes. So I think it's very multi-dimensional.
Absolutely. And we're sort of saying have they judged by doing the health literacy, has that actually, the impact on admissions? Is it possible to gauge that? Have there been any studies to prove that health literacy really does make a difference to A&E admissions?
I think it's such a vast area that individual small-scale studies would maybe not be able to capture. I think the most I can say in terms of that is kind of studies into public health and specific public health concerns, and the information that patients are able to understand and receive. And in that respect, it does have a lot of beneficial implications in terms of kind of the cost of that public health concern and the outcomes for patients. There's many studies that I can't recall one specifically, but there's many studies that will provide a clear link between a patient's understanding and their engagement and the outcomes.
Absolutely. And what sort of barriers? I mean, when we're talking about health literacy, I mean, is there certain places that you think people should go, or how do you make yourself health literate?
I mean, it's a very holistic area. It's the responsibility for health literacy is not solely placed on an individual. I think it's governments have a very keen responsibility for this area. Local charities, local authorities, even the food and drink industry has got a responsibility for kind of promoting this understanding and the way that they're food and drink affect health. But I think that a person's personal responsibility for it needs to be more nourished, and ways that they can do that. I mean, platforms such as Talk Health, for example, it's a support system. There's advice, you can connect with experts to understand more about your particular condition. I think things like that are really important, and there's lots of avenues which can assist in this sort of area. For example, there's apps, condition specific apps, data tracking of your own health, things like that. I think it all combines to create that sort of more health literate ability.
Yes, and it is interesting, isn't it? Because for example, whenever I think of public health, the one that always springs to mind is all the campaigns to stop smoking. That's just a huge public health thing. And now there's, the other one that we've spoken about. Funny enough, we've spoken about in our coffee mornings, is about putting the calories on, onto large chains. Do you think that's helpful? And I think that's probably asking you something that's a bit contentious, but do you think personally, that's helpful, putting calorie counts on menus?
I think that there will always be two sides to any decision made like that. There's always going to be people that will be affected negatively, and there's always people that might benefit from that. I personally find it quite beneficial to know what calories are in my food, but I don't necessarily know if I need to have that on the food, on a menu. If I wanted, but again, I think that is quite a contentious issue. And there will always be people on either side of the fence on things like that.
I know that when I've looked at health menu, I look at them and think, oh gosh, but I won't have it because I didn't realise quite how many calories was in it. But if I went out the next night to a restaurant and there was a menu and it didn't have them in, I would go and have that. I would have that choice. But it's obviously it's a much bigger issue than that, because it's all around the psychology of food. But I suppose if you were health literate in many ways, you would, if you were looking at the menu to look at the calories, you would sort of know how many calories there are. But actually, that's not what it's about. It's about the issues that it can trigger, isn't it? It's more of a mental health issue for many ways with having the calories.
Yeah, and I think it's not just about understanding. It's being provided with the information, whether that's you've gone to find it yourself, or it's been given to you. So for example, the calories, that's information that's been given to you, and it's your decision. People are allowed to make their own decisions around health. Information isn't provided to push someone into one way of thinking or the other. It's merely there for them to make an informed decision, and whatever that decision may be is their own decision. So if you've decided not to eat that, that's your decision. But if I decide to eat it, that's my decision, but it's an informed decision because it's there in front of me.
But then perhaps I shouldn't have brought up calories because it is contentious, isn't it? Actually, we do need calories. That's the other thing, is there's good and there's bad calories as well, isn't there? So so one of the things that we've written about is tips for effective self-management. So I don't know where you want to start, and maybe giving some case studies of how health literacy can really help, especially in relation to chronic health conditions, would be really helpful.
Okay, I think in terms of kind of self-management, there's numerous ways that a person can improve, their ability to manage chronic conditions. Obviously, one of the main things that we did touch on earlier is the use of evidence-based information. That's really important to stress that. But more specific ways could be kind of the digital apps that I've discussed. I think another thing that is a really useful way of managing a chronic condition especially is the use of kind of, journals. So if you've got condition-specific journal, you can track your symptoms, you can keep all your appointments, your medications, your treatment. And I think a lot of information gets quite lost when somebody's being talked about a condition by numerous different healthcare providers. And generally, someone with a chronic condition will have numerous different practitioners involved in their care. And I think it's very useful to have that information in one place, because it aids the ability to retain that information. If you've got an appointment coming up, you can write down some questions so you don't forget, because I know that, everyone's guilty of that. They've got a meeting coming up and they've got a really important question and it just completely slips their mind when they get there. They don't ask it. That's quite a natural response. But I think if you've got everything written and you've got it all in one place, it really would help with that management, and it helps as well to promote that patient, participation with the process. It's not all being told how to manage it. You are entitled to also participate in the management of your own health.
But I think that's absolutely fundamental. It's, a lot of people think, well, I go to hospital, your job as a healthcare professional is to sort me out. It's like, no, as a healthcare professional, you can support, but it's within the patient to be able to adhere to what is maybe best practice or what they've been asked to do. And I completely agree about tracking. I think tracking is so important, because you think, oh, I feel so ill, but you don't remember. The following week you forget. And if you can give the healthcare professional that information, is really, really, really helpful, isn't it? I'm sure.
Yeah. Mm-hmm.
So one of the, we did get a question earlier saying, from somebody wrote in, I'm aware A&E are under pressure, but I've got multiple chronic conditions and subsequent requirements which get ignored despite trying to get a PMP in place. A PMP is a patient management
plan.
Right. And when do you get those? Or who creates those?
It wouldn't be A&E that would create a patient management plan. If they're wanting that in place, it would be something in the community, maybe the GP or their specific sort of, say it was an oncologist or a cardiologist, or I think it's more in the community that would be put into place, but it would be disseminated to A&E as well. It's like it's a plan really for what would happen in an acute episode of care, I think.
Right. So this person needs to push harder to try and get someone to give them a PMP. But what they then got to say is left me petrified of hospitals, and I avoid them even when my blood pressure is 214. How can I help staff more? I think you've also explained a lot by if you've got the information available to give them.
Mm-hmm. I think in this respect as well, obviously A&E is there to treat the symptoms that have been, that's presented that day, or in the acute episode of care. I know I've said that multiple times, but it's not really about, obviously it's a holistic approach, and your chronic condition will have a huge impact on that. So having that information to hand is obviously very helpful for staff who might not have an awareness of your condition. Patients to me have always been the greatest aid to care and their own management, because generally a lot of them, some of them don't know, which is what we're talking about, but a lot of them do know what's going on, and it's their condition, they live with it, they're aware of the symptoms. So just explaining that to whoever it is that's caring for you at the time, and discussing that what's led up to this incident, and that is really helpful to give them that kind of background knowledge. And like I said, keeping a track in a journal or a folder, take it with you if that's going to help. If you've got a lot of a multitude of different conditions, for example, because they might not always have specific access to every single piece of information that you've ever attended. They will have an overview if it's within the same trust, but they might not have access to every little detail of your condition, and that's where you come in. You can be the one to kind of discuss that with them.
So, I mean, we mentioned earlier when we were talking before about that, you know, you are, one of your roles was very, as a sister, you said you was a matron.
Yeah.
I don't know, do they have matrons anymore? I don't know.
No, I wasn't a matron, I was a sister.
It's being triage, and obviously the triage is very, very important, because you're the person determining actually what's the thing that is, you know, that really needs to be looked at or treated first. So would you find, you know, especially if you're going, you know, you're out of area, so you go to an A&E where they may not have your files, because we know that everything's sort of dispersed everywhere and it's impossible to find everything. If you, you know, as you're sitting as a nurse, what are the things that you want people to tell you straight away? What do you find that helps?
I think that the difficulty with triaging, especially, is that especially in A&E, is that it's very, very fast paced, very quick. You get a very small amount of time to talk about a person's issue before you have to make the decision for example, if they're going to get sent to another area in hospital, what prioritization they are in the department. But I think the most important thing is just to relay what's brought you to A&E that day. And then kind of discuss the background of your conditions as alongside it. Mostly I would have a general overview of a person's conditions if it was the same trust, but like you said, in a different trust I might not have any information at all. So I think it's just important to be quite concise about the reason that you've presented to A&E, what's happened within the last 24 hours, and then go into the details about the conditions.
Absolutely. So when we put here current trends, what is current trends? Is that what people are doing now with literacy, or?
I guess current trends to me is I mean, the pandemic has kind of changed a lot of people's attitudes towards health. I don't know if that's necessarily in a good light or a bad light, but it's definitely shone a light on the importance of understanding about health. I think millennials and kind of younger generations have got a more, their concern for health seems to be growing. They utilize, you know, health applications, devices. They're more concerned about their own well-being and their health, and that, although the burden of disease is still growing, the concern for individual health seems to be growing alongside it, which I think could potentially increase patient engagement and management if we can keep that, you know, that trend going.
Absolutely. So so the trend is, I mean, health is far more, I mean, when I was younger, I can't remember ever talking about health really. It just wasn't on the agenda, but now everybody seems to be talking about health. And what's interesting is, you know, we talk about sleep now. Now, nobody would ever talk about sleep before because you used to take it for granted or never thought about it. But it's sort of, sleep and mental health are just huge. And are they things that people mention in A&E at all, or is it something you're very aware of?
I guess it just depends on the context of why somebody's attending A&E. If they're coming in for a mental health problem, sleep might be mentioned because, you know, they can't sleep, they're stressed, that, you know, it's exacerbating their conditions. I think you're right though, it is becoming more of like a highlighted concern that people are concerned about their sleep and their mental well-being, and people are more open to talking about their mental health, which I think is really important. There's always been a lot of stigma associated with mental health in the past, and it's improving definitely because people are more open to discussing it, and it's become more of an importance for people.
Yes, and I think it's a concern for people as well, isn't it? It's far more of a concern for people, and I think, you know, maybe life is far more stressful than it ever used to be because things change so much.
Yeah, potentially, or it just wasn't talked about before, and now it's it's a lot more discussed, so it's more in the forefront of people's minds.
Absolutely. So yeah, I'm just having a little look through some of the notes that we've made about it. So with health literacy, I mean, and I know we spoke previously about, where does it all start? Does it start, do you think, is it best to be starting in schools?
So this is obviously a topic that we've discussed previously. Everyone's got a broad view of what health means, but people tend to gain a more in-depth understanding of health when they're kind of faced with a circumstance that makes them want to educate themselves, like, they're diagnosed with a condition, something happens to a family member. But my opinion is that by educating children young, we have an opportunity there to improve the public health outcomes going forwards. I mean, my 3-year-old definitely eats too many ice creams, and I'm not going into depth with her about disease management, but I definitely teach her about kind of hand hygiene, how to look after her cuts and bruises, her diet, small areas of health that she can comprehend. But at a certain age, she will be able to understand the deeper subjects of health. And I think that we're kind of missing a trick almost in not putting more focus on educating children in schools as a standardized approach, really. I think it's really important.
I don't know if you know, but I mean, how much health education people, is it called PSP or something, PH? I can't remember what they call it now. I mean, personal health and something.
In the national curriculum, do you mean? I mean, I know that they've recently adjusted the national curriculum. They've added kind of education around relationships, and obviously there's the sex education aspect. Oh, hang on, so you hear me?
I can hear you, but you've stopped moving. Oh.
Hi, sorry, I think my connection got there. Sorry, I'm back. Yeah, so
that you are a long way away. You are in Spain at the moment,
yeah.
So maybe that's why.
Sorry. Yeah, so I know that they did add kind of like CPR and some basic first aid skills, but I mean, I don't know about now, but when I was at school, it was kind of provided in a lesson, right, in a scattered across a number of lessons, rather than in a sort of dedicated lesson about health studies or a dedicated kind of program. It could even just be a number of weeks, but a dedicated kind of section of time within a school curriculum to talk about health, which isn't really how it's provided at the minute. I mean, I'm not a teacher, so don't quote me on this, but I think it could definitely be improved upon.
Absolutely. So yes, definitely improving children, but it's, just basic first aid would be really helpful, wouldn't it, to start with? And then looking how do you look after your health properly, so that you don't hopefully move into some more chronic health conditions. Is there one of the things that I'm aware of, and we're talking about those sort of what would they call, the patient management plans. So for example, I know that some people go into A&E because they've had flare-ups. So with chronic conditions, obviously you can get acute flare-ups, and so surely if people were more health literate, that would help them not to have to go into hospital, because it's the same treatment, isn't it, that they have to go through with a flare-up?
Yeah, so I guess in that respect, it's really about working alongside your healthcare professional. If you're aware that you get severe flare-ups regularly, I mean, earlier we talked about eczema with children, and I think that it might be beneficial to discuss with kind of whatever your provider is, your GP or your nurse practitioner, and see if there's any prophylactic treatments that you could have in-house that would avoid then a visit to A&E and panicking that you're having a flare-up. But I mean, a lot of visits to A&E are unavoidable. That's kind of the nature of an emergency department. But I do think that kind of having that knowledge and the understanding would help to limit that exposure to a hospital slightly in these sort of instances.
What, in your experience, what are the things that you think would, are there certain things that you see people coming in time and time again, maybe, I don't know, a wasp sting, or I don't know why people go into A&E apart from obviously having heart attacks, or, well, I mean, I suppose with heart attack, or is it heart attack or stroke, you should have a Disprin or aspirin, or I don't even know, but those things are really important to know, aren't they?
Yeah. Again, this is I think with things like heart attacks and strokes, these are the sort of conditions that we maybe could be educating our children more about, maybe, but you don't want to scare kids, do you, about, oh, this could happen, this could happen. It's difficult to, in the moment, learn very quickly, oh, I need to do this because I think I'm having a heart attack. That's more of a, that's more of like a public health campaign sort of, information. With chronic conditions, I think it's a bit different because, you might have risk factors for heart attack, in which case you would be able to educate yourself about what to do in the event of you think you're having a heart attack. But chronic condition wise, I think that's really where you can gain a much deeper understanding, and I think that's really what your platform kind of focuses on, isn't it? About support and advice for kind of chronic conditions.
Yeah, I mean, absolutely. And what we try to do is, how you manage symptoms and how they can flare up without you, there's no, I suppose it's important to understand what your triggers are for a condition. The more you understand your triggers, the more likely you're less to go into exacerbating the problem and going into flare up. And then when you are in flare up, okay, what do you do to manage it, rather than panicking, thinking, okay, this is what I do step by step.
Exactly, and that basically is a way of describing health literacy. It's having that understanding and knowing how to use that understanding to kind of benefit your own health. So like you just said there, what will happen if you have, your triggers for a flare-up, so you will avoid them as a first point of call. But if in the event you do have a flare-up of your condition, you know what to do in that event. You know what to do to really alleviate the symptoms, or whatever it may be, pain management, and you have that understanding, but also how to use that understanding.
And do you think we should be lobbying the government more for more public health type of information?
I don't think necessarily, no, because I mean the government spends a lot of money on public health campaigns. I think a lot, it's because the responsibility for this is so multi-dimensional. It's difficult to place the onus on one certain person or avenue or government or charity. I think people need to take a responsibility for their own understanding as well, but like we've discussed, there are barriers to that, and it's working alongside your healthcare providers and alongside the kind of digital the apps, the information, everything that you've got at your fingertips, really, to kind of develop this health literacy, really.
No, and I can, the more one talks about it, more you can feel like, oh my gosh, if we can get it more into the educational system earlier. So, when we're talking about strokes and heart attacks, and even, when people are around, first aid and things like that, when those things, when you're taught all those things when you're much younger, they're just there in your psyche, aren't they? You don't think about them. You know how to react and what to do straight away, hopefully.
I mean, children soak up information like a sponge. It's like second nature to them to learn. So I think it is definitely something that we could be utilising more. But I know that there'll be an opinion on this either side. Again, it's like the calorie thing. Some people say it's a parental responsibility, which it is, but I think a standardized approach to this in schools could also have drastic positive repercussions for public health going forwards, next generations.
Absolutely. Is there anything else, because I know it's a passion of yours, is there anything else that you want to sort of say about it, or what you think we could do to improve it ourselves or as a nation, or?
I don't think so. I think we've covered quite a lot of of it, really. Yeah.
Yeah, so it's encouraging people to understand if particularly if they've got a chronic health condition, to understand it properly, and all the things you can do to prevent going into some form of relapse, to stop you going to A&E and all of those things. And I know that we haven't. Yeah, I know I brought up calories, but obviously the other contention is the waiting times in A&E, and how people are using A&E almost like their doctors, their local surgery, aren't they? Popping in there as their local surgery, which is very difficult.
I think there's a lot of pressure on NHS resources, especially since the pandemic, where a lot of kind of like surgical wait lists have been postponed, and now it's kind of, there's a big backlog of appointments and things like that. And this isn't in any way to deter anyone from going to A&E. That's absolutely not what this is about. It's more just kind of, there are many services available, and it's just about encouraging that kind of active participation in your own health, and that active engagement. And it's more around that, and then you will have more tools to manage your condition. And there's lots of other services available to you. People need to go to A&E. That's not what, we're not trying to deter that. But it's just about having a broader understanding of your own health, I think.
Yeah, and yes, and highlighting how important it is of the ownership of your condition. It's not somebody else's, it's your ownership. I think.
Exactly.
Well, it's been really great. I feel like we've just had a general chat, which has actually been quite interesting and refreshing. But it's bringing to the fore how important it is to read up from evidence-based resources, and there are so many different types around there, from patient groups like us through to the NHS, through to charities, etc. So thank you very much for your time, and it's been lovely meeting you, and hopefully we've inspired some people to go and read up further on their condition and become more health literate, I think.
Thank you.
Thank you. Bye everyone.